Good afternoon and welcome to the St. Clair County Daily COVID-19 Briefing. Today I'm joined by St. Clair County Board Chairman Mark Kern and the Director of the St. Clair County Health Department, Barb Holt. Today Barb has our numbers for us. Barb, thanks for joining us again.
I do, thank you. Good afternoon, everyone, on this gorgeous Sunday afternoon. We'll run down the numbers quickly and we'll get to question and answers. So far in St. Clair County, we have tested 86,753 COVID folks, and of those, we have 49 new cases today for a total of 7,357 positive. Of those 49, we had both males and females under the age of 10 to 90 years of age. This brings our daily positivity rate to 5.8%. And again, we're very proud to say our seven-day rolling average for St. Clair County is 5.9%. Doing great. Keep it up, Team St. Clair. Excellent. Fortunately, we have no additional deaths to add. Again, our thoughts and prayers go to all those COVID-related deaths that we've had in St. Clair County over the past since March of 189. Those that have completed the IDPH required 10-day isolation period is a total of 6,663. Statewide, the state of Illinois has tested 5,479,510 folks, and that is today we have a positivity in Illinois, an increase of 1,604 cases for a total of 287,930. Unfortunately, in the state of Illinois, we have an increase of 14 deaths for a total of 8,601. And again, our thoughts and prayers go to those family and friends of those that are deceased due to COVID-related illness. Hospitalization numbers currently in St. Clair County hospitals, we have 49 COVID-19 related patients, and of those 49, 5 are on ventilators. Region-wise, we have 83 patients that are hospitalized due to COVID-related illness, and of those 83, 7 are on ventilators. We are very happy to report we have no additional cases in the congregate care or long-term care facilities for today. And also, I would like to remind folks of our test sites coming up this week. On Tuesday and Wednesday, we will be out at the SWIC campus, 8 to 4 both days. We have both drive-through and walk-up at the college. That's available. And then next weekend, we have drive-through available at SIUE Edwardsville. And again, there's several other facilities that are available. Please check our EMA website or our St. Clair County Health Department website for all the testing facilities that are available in our local area. So with that, I will turn it over to Chairman Kern. How are you, sir?
I'm good, Barb. Thanks. Appreciate you being here today.
Absolutely.
So we'll go into the zip code report. These are the changes in St. Clair County zip codes since yesterday. So in 62201, we go up 3 to 246 COVID positive diagnoses. 62203, we go up 1 to 210. 62204 goes up 1 to 143. 62206 goes up 2 to 449. 62208 goes up 3 to 439. 62220 goes up 1 today to 576. 62221 goes up 3 to 686. 62223 goes up 3 to 436. 62226 goes up 6 today to 758. 62239 goes up 1 to 116. 62243 goes up 1 to 109. 62254 goes up 3 to 273. 62258 goes up 1 to 192. 62260 goes up 1 to 147. And 62269 goes up 3 to 572. As Barb said, the daily county positivity today, these are St. Clair County generated numbers as of 2:30 this afternoon. Our daily county positivity is 5.8%. We put that in the 7-day rolling average. That gives us 5.9% rolling average. So I think that's 11 days now that we've been below 6.5 in St. Clair County. That 6.5 number is the number that the state is using, wanting to take a look at to see if we can go back to opening up bars and restaurants to inside dining. So we're hoping they're taking notice of that number. According to the state, now these are the state's numbers, our regional positivity today remains at 6.9%. Bond County came in at 14.3% today. Clinton County at 9.0%. Madison is at 3.9%. Monroe 2.2%. Randolph 1.2%. St. Clair's at 4.2%. And Washington County is at 5.6%. So those numbers are getting better. The region is looking better. I think those outer counties seem to be working and pulling in the same direction we are. So let's continue that.
Absolutely.
Brian, we got some questions today?
We did. We're doing question and answers now for several months, so the amount is a little lower today, but some new questions, some topics that we haven't covered yet, so we will get into these and get some answers. The first one here says, Governor Pritzker posted on Facebook, in Illinois, if you want to test, it is available absolutely free at any of our state testing sites, regardless of your citizenship or insurance status. I am confused. Some places ask for insurance cards and others don't. How are the tests being paid for? I assume the CVSs and other businesses are charging the insurance company. How much do the free tests cost? If you can't provide the answers, where can one obtain that information?
Well, I'll be glad to address that. Yes, IDPH at their testing sites like the Jackie Joyner Kersey Center, the ones we have coming up Tuesday and Wednesday at SWIC, and other ones that we have, the ones they sponsor are totally free. The ones we've sponsored through Southern Illinois Healthcare Foundation are free, but we may ask for your insurance card because if your insurance will pay for it, we'll allow the insurance to pay for it, and that saves us more money to do more testing through the grants that they have available to provide the services to the community. As far as the cost of each test, I'm really not sure. I've heard the saliva tests they can be maybe around $10 produced for that, but that's not definitive. I'm not sure what the other lab costs are for either the nasal or the oral tests. Again, those are provided by IDPH or CBS or other providers, Walgreens and other providers. Different tests, I'm sure, cost different amounts of money.
And the CARES Act funding that comes from the federal government, that money in the state of Illinois and throughout the state can be used for testing, and we do use it for testing purposes here. So all of those dollars are flowing, but if we can get insurance companies to cover, as you said, that allows our dollars to go farther for other things, including contact tracing and purchasing of PPEs, whatever we need to do. We're making every dollar count in St. Clair County.
Absolutely.
Okay, and the next one says, we need faster test results. Lives are being put on hold while we wait, and people running around potentially spreading the virus while we wait on test results is ridiculous. When will rapid tests be available to everyone like the Cahokia Walgreens? Can you list all the rapid test sites, and are they for adults or kids? With kids starting back up to school, rapid testing is very important to help control the spread.
Testing is, absolutely. It's a good methodology and the one thing we have at this point in time to specifically test for the virus. But one thing we need to remember all the time, we need to practice wearing our mask, washing our hands, and do our social distancing. That in itself helps control the spread of disease to begin with. Again, this virus is sneaky. You may not feel sick and you can be asymptomatic and have picked it up and have no idea where you might have picked it up from. But as far as the testing, as I said earlier, there's several different types. There's the rapid test that a couple of facilities offer. There's a nasal test, there's the oral test, different kinds. Different types of tests were designed to be their laboratory results, how long it takes, and their efficacy, their accuracy, and as we talked earlier, their cost. How much does it cost, and which ones we're going to use, which ones are proven to be more accurate. All that goes into effect in deciding which lab result to use. IDPH has chosen, as well as our FQHC, to use the either the nasal or the oral swab test, which requires an actual certified lab to do the test results for it. That's how they're approved to say they're a bona fide test.
So Walgreens in Cahokia is the only one that we currently have offering that rapid turnaround of about an hour, and that test is only for those 18 and above.
That is correct, and I think there's another rapid test in Alton as well, in Madison County, but that's one of the very few ones that are offering the rapid test. And even with that, I've heard, you may get your test results today, but you might have to wait a day or two to be able to get an appointment to get in because they are very busy and booked.
And that's similar advice we've given to people. They say, well, I want the rapid test, but they can't get me in for 3 or 4 days. We say, well,
Right.
go to Jackie Joyner Kersey today, and you might have your results in time, but go ahead and make that appointment just in case.
Exactly. And the lab reporting has been better. It's been quicker, but again, it takes time. It takes time from collecting the samples, getting them to the lab, do the actual lab testing, and then reporting out the results and getting those to the individual. So lately, it's been anywhere from 3 to 5 days, what we've experienced at the health department through IDPH lab testing for both our Department of Public Health testing through IDPH, as well as our Southern Illinois Healthcare Foundation testing.
Okay. The next person writes, how do you enforce individuals to wear a mask correctly when in an establishment? Everyone should follow the mandate to help lower the spread.
Again, within a business, as the mandate and as the law states, it's up to the business owner to mandate his employees and his patrons. He or she is the person responsible to ensuring that the folks coming into his facility or working at his facility are the ones to enforce this. And if there is a violation, they are the ones that are going to be cited.
Okay. The next person writes, is St. Clair County Health Department offering free flu shots this year? BJC announced they are in several locations and to check with them for locations.
Again, historically, the health department hasn't offered free shots to the general public. We offer flu shots, immunization shots for children under 18 years of age as part of our regular routine immunization program. But there are several facilities, businesses, BJC, and other pharmacies throughout St. Clair County that offer free flu shots.
Okay. And we'll post some of those on our EMA website as you make us aware of where they're at, because obviously I know that's something we've talked about this year is a flu shot's going to be very important.
Absolutely. And they're readily available throughout the community.
Okay. The next one says, several retailers have removed all of their stickers for 6-foot social distancing, mask monitoring, and many have even ended sanitizing their carts. Do you think it's a bit too soon considering we're still on lockdown?
Absolutely. I mean, we've been saying from day one, we need to practice the 3 W's. Not only for COVID, though, but, it helps protect from different types of respiratory illness, like the flu, like any other type of illness that you may transmit through your hands, through soiled hands. This is no time to become complacent. We've worked very hard to get our daily 7-day rolling average to 5.9%. We can't stop now. I mean, we can't undo what we have done. We need to make sure we continue to wear our masks, continue to wash our hands. The business owners need to continue to comply. Obviously, what we have been doing works, so we can't stop now.
And even the most optimistic projections that we hear say that this is going to be well into late spring, early summer, that we're going to be faced with having to fight the spread of this virus in our community. So we shouldn't take our foot off the gas, as Herb always says. We need to just continue to do what we're doing and try to keep this number driven down as low as we possibly can. We're not satisfied with 5.9%. We want it to be 0%. That's the ultimate goal.
Absolutely. And, as the weather gets cooler, people are going to be moving indoors more. Again, more opportunity, enclosed spaces rather than being outdoors. Please continue to wear your masks, wash your hands, the 3 W's, social distancing. We need to continue it.
Okay. And the next one says, can you repost and discuss the current restrictions for our region? There are bars and restaurants allowing patrons to sit inside.
again, according to the latest mitigation efforts for Region 4, indoor dining is not allowed. We continue to work with the Sheriff's Department and our local police departments to ensure businesses are continue to follow those mandates. Outdoor seating is allowed. We hope, and again, as we said, we're doing the right thing and bringing our numbers down. We continue to do that. We hope to open up indoor dining, but we can't say it enough. Please don't become complacent. Please make sure you wash your hands and keep your masks on so we can continue to move forward and get back to full phase 4.
Well, and as soon as we get to there, it's going to be important that these mitigations are maintained, because by allowing people to resume indoor dining and stuff, as you mentioned, putting them back in those closed spaces, the last thing we want is a quick turnaround back to additional mitigations.
Exactly. We've all worked too hard to get this far, and we've been working together and very successful at doing that. Let's continue it.
Thank you very much. The next question, Chairman comes in and says, when we talk about daily about the hospital ventilator patients, does it include all ventilator patients or just those with COVID? And you saw that, not necessarily sent in with the questions, but somebody had been talking about it on the page, and that was a good question you brought up, and it truly is just those on a ventilator related to a COVID illness.
So therefore, there could be more ventilators being used than just the ones we report every day. And the reason for reporting that number is some people take that number and see how serious the COVID is in the community, because when a person is on a ventilator, that's tough. I mean, they really are fighting this with every tool available. But also, it also tells us the amount of ventilators that may be left, because you need to have a reserve of ventilators should there be a spike of COVID. That's really why we've been here for now, what is it,
198 days.
198 days, because originally the purpose was, let's control the spread so that we have enough capacity in our hospitals, not only of beds, but of ventilators.
Correct, and so far we've been able to do that, but like you mentioned, today 5 people on ventilators, but that doesn't mean only 5 ventilators are in use in St. Clair County hospitals. There's definitely other illnesses besides COVID that unfortunately people could wind up on a ventilator.
Right.
So, as we talk through this whole process, one big question and something we talk about every week is schools.
Well, and who knows more about schools in the world than Susan Sarfati, our regional superintendent of schools. And Susan, we got some additional news today from you. You are retiring as the regional superintendent after 20 years?
I haven't been regional superintendent for 20 years. I've been at the regional office for 20 years. I've been in education for 40 years.
40 years.
I know. And so I have been regional superintendent for 9 years.
Wow. So you ended up at the top. That's the pinnacle, is to be the regional superintendent. And you've done
probably debatable, but thank you.
you've really done very well, and certainly you've been a frequent guest here, and really not a guest. You're a part of the team who's been talking about schools. And do you have any update today on? We're seeing, and someone posted, a member of Team St. Clair posted that we're seeing the younger ages starting to rise. I don't know what that's related to. Don't know if it's because we're going back to school. You really can't say. But what are you hearing from our school superintendents?
Well, our school superintendents are watching those numbers very closely. Our schools have a variety of plans of bringing students back, and they've started those plans. As we talked about several weeks ago, they've started with the neediest children, their special education students, maybe our ESL students, English as a second language students, and those children that need that face-to-face contact. And we're slowly bringing back other students, either in a hybrid model or by grade level. And so I guess we're going to see those numbers continue to rise in our school-age children. So what we really want to stress is that you at home practice the hand washing, and I'm talking about with our younger students. I think your teenage students know washing your hands, the social distancing, and all the things that we do besides wearing the mask. Those are just the start of what we should be doing. But your younger children do need to practice those things. Children like the age of 5 don't always understand space relationships, so they don't know what 6 feet apart looks like unless you show them. So the more we do that, the more likely we'll keep those numbers down for our school-age children. So that's my message to you and to everyone watching.
Well, if the world had more educators like you, like yourself, we'd be far better off in this world.
That's very kind of you to say. Thank you.
We appreciate you, and I wanted to make you cry, and it looks like
You are going to.
I don't think crying's allowed with COVID either, but that's not one of the 3 W's. We'll have to figure that out. So there we go. We're going to end
Thank
on
you.
a sad note with you today, but
No, it's a happy note. But
it's a
thank you.
happy note. It is, and we may get you back here for a wrap up when we do the wrap up show.
Okay, I'll come.
Good.
Susan, we want to thank you for joining us again today, and on behalf of Director Simmons and the emergency management, we want to wish you the best in your retirement, and thank you for being here, being a part of Team St. Clair for the last 198 days, and we only hope that your replacement is as aggressive in helping us with slowing the spread of COVID-19 as it is in the schools.
Well, I will always be a member of Team St. Clair.
Well, thank you very much. We thank you all for following us every day. We'll be back in a few minutes with our ladies to transmit this into our Spanish-related communities, and then we'll be back tomorrow at 3:30 with the next daily briefing. Thanks for following.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and